to the New England Take. I'm your host, AJ Kierstead, NewEnglandTake.com to get more from the show, and that is a Substack, so you can go over there and support the program and get every episode in your inbox, as well as our YouTube podcast and all those things. Big thank you to WKXL for picking up the show 8:30 a.m. every Saturday on broadcast radio, and GraniteGrock.com for picking up the show every Saturday evening. Concord TV, if you listen on your local television station here in Concord area, AJ at NewEnglandTake.com if you want to reach out to the program. Excited today to be joined again by Dr. Jason Aziz. He's an exercise physiologist and nutrition scientist. He holds a PhD in food policy and applied nutrition science from the Friedman School of Nutrition Science and Policy at Tufts University in Boston, Mass., where he currently teaches physical activity, nutrition, and health. He also serves as a health economist at the New Hampshire Insurance Department, where he sees firsthand the excess costs incurred to society, more specifically healthcare systems, by physical inactivity and poor diet. Welcome back to the program.
Thank you. I love New England Take. Thank you for having me. I feel like it's a bit of a home for me.
Yes, definitely. He was on a couple months ago, so be sure to check out the YouTube channel. We talked about what is public health and why it's important. It doesn't matter what side of the political aisle you're on, it does have an impact, and it's something that definitely should be taken seriously from a policy perspective. But in your world, nutrition, science, and all the health and economics, for that matter, also especially, the big news over the last week here, where the Trump administration resets U.S. nutrition policy and puts real food back at the center of health. And this kind of goes back to the whole RFK, what he's been up to since he got into the role as leading the Department of Health and Human Services at the federal level, and the MAHA movement, Make America Healthy Again, has been big when it comes to headlines and such. And this is like the first time it seems like it's actually coming through from a policy perspective, where it was hilarious. As always, South Park called it first, where they had this whole video where the scientists are in the lab and they say flip the food pyramid and they put in all this stuff and it just goes bam, and then that's it. But this is actually legitimate. This is some big policy shift that is aiming to be accomplished by doing this.
Yeah, that's a lot. And it's on the tip of my tongue, and a lot of my colleagues at the Tufts Friedman School who consider this, as their whole career. Mm-hmm. I did not know South Park flipped the food pyramid upside down. And, I see that as intuitive. Some people may say counterintuitive, but I mean, I don't think that there's anybody that can argue that our nutrition guidance has been working well for us citizens with regards to just holding constant the consistency in government mandated dietary recommendations, but two, the outcomes that is produced. I mean, diet-related diseases are ubiquitous, they're pervasive, and indeed it's one of the, you mentioned the public health piece that we did a few months ago. Health used to cross party lines. Yeah. Now, you don't really see that. And I think this is an excellent example. These new recommendations coming from the government, although they're slightly different than what preceded them, they're not dramatically different. No. Yet, a lot of the media and certain subsets of our population are citing them as draconian or idiosyncratic. And I just can't say that I see it that way. I think it addresses a couple of key concerns that I've had for a long time about the standard, the incremental nutrition guidance from the USDA. So I laud these efforts, even though, they're being contested and they're laden with political intonations, some that should truly not exist.
Yeah, definitely. We want everyone to be healthy. I mean, this is the whole issue we've been talking about for years. I feel like COVID really opened everyone's eyes to the nature of public health and exists. And once again, we talked about that more in the previous episode. But this is actually what you put in your body has tremendous impact on obesity levels, long-term sustainability, being able to function later on in life as opposed to being disabled through various cardiac and other sort of diseases and things of that nature, and to actually put a priority where we're going to change it around. I mean, the joke was forever that the old food pyramid is, oh, it's so great. It tells you to eat Lucky Charms as like the baseline because it's the cereals. That's the focus. When meanwhile, that's not necessarily the sort of approach that people should take. It should be a lot more reflective of this sort of new recommendations.
Yeah, that's right. I mean, one of the things that I was blessed to learn at the Tufts Friedman School is how complex the undertaking is to recommend to a very heterogeneous population of over 350 million people what they should eat, when they should eat it, and why they should eat it. And it is no easy undertaking. And really, as a long-term, almost unintended consequence, the iterations, every 5 years, the dietary guidance is reissued, and they make a new food guide graphic. And that's done because the field of nutrition is actually what I call a naive science. Really, federal government funding of nutrition research on humans only started in the mid-1980s, and in fact started at the Tufts Friedman School from a grant from the USDA elicited by Ted Kennedy, of all people. Now you have his nephew stirring up the waters. But most other tracks of medical sciences have hundreds of years of tenure, but not nutrition. Nutrition only has about 40, just over 40 years of formal government funding, which is where most funding for science comes from. Because of that, it is very dynamic, evolves and revolves, and here you see a revolving, a revolution of it. And that's important. The other thing that I think I've noticed as an unintended consequence of really the way we've approached dietary guidance from a governmental perspective is it's resulted in an eat this, not that outcome. And that's really bad. And I'll give you one example of the insidiousness of it, is that it's created vilification of certain foods, like, say, red meat, which is very rich in heme iron, an important form of iron for all human bodies, and calcium deficiency from the absence of dairy intakes, right? And it's also created this other perverse response that we call health halos, this perceived health promoting property in certain foods that may or may not exist. And if you can't tell from my tone, oftentimes it does not exist. And coconut oil is the best example. It is one of the most dense food that contains the most densely saturated fatty acids. Even though they're medium chain triglycerides, fatty acids, they are the planet's most densely saturated fatty acids. And the recommendations always have, and still continue to, encourage decreasing intakes of saturated fats in the diet to be below 10% of total kcals. So it has been unintended, these increase in plant-based fats, but that have lots of saturated fat, and you create health halos, which has a lot of not just social and dietary, but economic concerns for people like me, because they're very expensive. If you look at the cost of coconut oil and avocado oils, they're 2 to 4-fold more expensive than their less saturated fatty acid counterparts. And that doesn't reflect an improvement in dietary status nor the economics of the whole market basket to me. It actually represents misinformation. So I think that these new guidance in some awkward way help to reconcile that a bit and maybe level set it for Americans.
Now, the first bullet here in the press release that they put out on this is restoring science and common sense. Is like for a government agency to put that as the first level of any press release, that's the thing that they're really aiming to get the headlines off of. Do you feel like that these new recommendations are beginning to at least make progress down that path?
I do wholly. I'd almost rather wish they reversed the order of the words, common sense
Yes.
and science. But a lot of people, my colleagues who I have the deepest respect for, are arguing against the statement about science. They're saying that this is a departure from science, and I don't really wholly agree with that. I think we have a few translational science gaps in what we're talking about. Nobody can argue that the prevalence of diet-related diseases, and diseases related also to physical inactivity, which is not decoupled from the former,
Right.
are at a very steep trajectory, and that trajectory is positive, meaning they're rising at a very steep rate. We know that in the last NHANES that the prevalence of overweightedness, BMI overweightedness, is almost 70%. We also know, while at the same time that exists, that the prevalence of BMI obesity is over 40%. So despite all of this science that we talk about, the nutrition-related outcomes and surrogate measures of them are getting worse and worse by the year, not by the 5-year increment or the decade. 5 years, the significance of that is that the dietary guidance is updated every 5 years. That's by design. So that there could be a logical fallacy implicit in my perspective on it, but I have more to say about that in a few moments. But we would have to agree, almost anybody would have to agree, that our dietary guidance doesn't seem to be improving the nutrition status of Americans.
Yeah, I mean, that's been the big thing that people have been fighting back against this, saying, well, you're completely ruining, you're making it so people are going to be more unhealthy because it has saturated fats in some of the top line of the new food pyramid. Is it a pyramid if it's upside down? I don't know what you want to call that shape, but the triangle, where people are freaking out about that. Meanwhile, the recommendations that have been there for so long have not necessarily yielded any positive response. Ever since they've started doing this in the 80s, Americans have gotten continuously more obese and less healthy, and people like to blame it on, oh, it's our healthcare system, it's this or that. Well, if people are entering the healthcare system already at a deteriorated state, they're not going to magically get better if they're continuing to have bad things happening in their day-to-day life, and then they go to the doctor when they're sick.
Yeah, I agree. I think, what you're talking about is, nobody eats triangles, right? We want to be thoughtful about the food guide graphic. There is a lot of work and thought that goes into that, and I'm impressed by it and proud to have been part of that along the way. We must know about the myplate.gov. That's an example. That's why that was created, because we eat off a plate, so most of us do. And the plate's partitioned, and some of it's protein, and some of it's vegetable, and some of it's fruit, and some starch. Recall this. I remind people of this a lot, and I do notice, because I talk about it a lot, it's a very enigmatic statement, but humans are the only organism on our beautiful blue planet that eat mixed meals. No other organism sits and eats their protein from an animal or an insect or some legume, and then also has a few bites of a vegetable, and then has some starch, and then washes it down with some milky white substance, which may or may not be actual milk. Nobody does that. Humans do that. The question is, does that make us better? Does that improve our dietary status? Does that improve our health with regards to nutrition-related outcomes? And if you can't surmise where I'm going, no, it does not. And so this whole idea of a food guide graphic is perplexing. And it relates to this translational gap that I mentioned a few moments ago. These scientists that are part of the DGAC, Dietary Guidance Advisory Council Commission, they're 50 of the best nutrition scientists in the world. Most of them are nutrition epidemiologists who actually study the relationship between nutritional exposures, dietary exposures, and diseases, nutrition-related diseases or other diseases, like colon cancer. I'm going to focus on colon cancer because that whole story is a fascinating one. It relates to the vilification of beef in our diet. And so because now beef is at the top of this pyramid, at the Y part actually, this inverted pyramid, people say, well, look at this new guidance favors saturated fat intake because there's a steak there. That's an example of a translational gap in the interpretation of nutrition epidemiology data, how a government may make recommendations to an entire population of 350 million people, and then how one person walking down their supermarket aisles are programmed to make choices to eat this, not that. What should go into my market basket? Indeed, yes, it's very clear, and even included in the Mediterranean diet pattern, that red meat can be part of a healthy diet. What's noteworthy about that long, almost rhetorical kind of passage I just shared with your audience is that the epidemiology data that showed a strong link between red meat consumption or just animal protein consumption and the risk of all-cause mortality for cancers showed that the U.S. was at the top of all the nations, and then the nations that have lower, but not zero, but lower intakes of meat had very low prevalence of gastroenteral cancer mortality. But it's important to interpret that's low intakes, not no intakes.
Right.
So then when that literature became ubiquitously known, the recommendation was decreasing intakes of red meat in the diet. But like all public health messages, they're very prone to misinterpretation, and people started to vilify red meat.
Correlation and causation issues.
That's right. Correlation doesn't necessarily imply causation. And so that's a fundamental tool of the nutrition epidemiologist, is to take intakes of a certain, say, food group or nutrient, food group in this case, red meat, and which is on a continuous scale by grams or ounces per week, right? And you create a population distribution, a bell-shaped curve. And then in order to ascertain what role does that play in driving cancer, colon cancer, let's say, in the population, you compare the highest level of intake, so the top quintile, to the lowest level of intakes, the first quintile. And you try to ascertain through statistical testing, is there a difference in cancer mortality with regards to red meat intakes in the highest versus the lowest quintile? And if you find that, plus a dose-response relationship, meaning in the second, in the third, in the fourth quintiles, you see an increasing relative risk of cancer mortality for the higher intakers of red meat, then you can start to infer a causal relationship between red meat intake and colon cancer. But that does not necessarily mean nor translate into a recommendation that say you should not eat red meat because it causes colon cancer. And that translational gap has brought us to a point where we vilified certain foods and we memorialize other foods. And what that has also done as a secondary unintended consequence is created or fed into a lot of fad diets that exist. Is these fad diets are well known to encourage risk for many, many nutrient deficiencies.
It is like, there's this thinking that when the government puts out these standards like that, like this is the be-all, end-all, this is how every single person should eat 100% of the time, regardless of the situation at hand, when that is not, they're guidelines. It's supposed to be where the baseline is supposed to set, and you go from there, because a lot of these sorts of things are used for other government policies to make sure that school lunches and things like that are at least going in the right direction. It doesn't mean little Billy, when he's going off to second grade, brings his own lunch and he has something else that he's eating, it's bad necessarily. It's just, these are where we're supposed to start. And what's especially fascinating to me with the kickback against these guidelines are, it very much matches the Mediterranean diet, which we're constantly told that, hey, if you're at risk for heart disease and things like this, it's universally suggested that you go on the Mediterranean diet, where this is the model of it. And wouldn't it be good, probably, even if you don't have already been diagnosed with cardiac diseases and such, to already be on the diet that's probably going to make you less likely to have these long-term diseases?
Absolutely, and it's been known for decades, actually, that the Mediterranean diet pattern. And I've actually, I have a manuscript, Mediterranean Made Easy, in the works. Story for another session, but I refer to it as the Mediterranean lifestyle pattern, because one thing that's very clear about Mediterranean cultures is that there is a tight linkage between their physical behaviors in the diurnal cycle, the 8 sleeping hours versus the 16 waking hours. We call that the diurnal cycle. And the bioenergetics of their diet, meaning when they're physically active, either just before or just after, they'll have more carbohydrate, which is where most of the energy in our diet comes in. But when they're about to enter a fasting state or a resting state, that's when a higher bolus of protein comes in. Remember what I was talking about a few moments ago with the mixed meal?
Right.
Part of the epitaph of the Mediterranean diet pattern, if you want to be secular about how you think of it, is that it doesn't really combine foods like the American My Plate graphic encourages. And so that's important. There's a temporal element to the Mediterranean diet that's difficult to communicate to people because we Americans eat generally this whole 3 square meals a day. And I know we've all heard this rhetoric, oh, it's better to eat small meals more frequently. That's indeed true. It'll probably never not be true. It much more closely resembles how human metabolism requires dietary sources of energy. The reason why Americans eat 3 meals a day and have for a while is because of this social cultural shift back in the late 1800s in the Industrial Revolution, where people left the farm, they left their agrarian lifestyles and migrated to metropolitan manufacturing jobs, i.e. shift work. And so
instead of like an organic, like, hey, it's the end of the day, I'm starving because I've been out in the field all day, where you might have had something a little during the day when you're out in the field, but you're getting prepped at the beginning of the day, and guess what? You're at the work day till the day's done.
That's right. And these big breakfasts, lunch, and then dinners, perverse metabolic or actually neuroendocrine response to that is massive amounts of insulin secretions in response to each meal. Yep. Because we're supposed to spread those 2,000 calories or 1,600 calories out throughout the day. But when we compartmentalize them into a big breakfast or a big lunch, that results in massive postprandial, after the meal, insulin secretions. And that's one of the most insidious milieus, metabolic or neuroendocrine milieus of the American diet. And that's one of the main differences in the Mediterranean diet, that it doesn't achieve hyperinsulinemia, high insulin in the blood. That's the number one cause of type 2 diabetes and metabolic syndrome, and it's probably my number one target with diet recommendations at the individual level.
So let's talk about the makeup of where the guidelines are now, where it's right now it's once again the pyramid is number 1, protein, dairy, and healthy fats. Number 2 in priority is vegetables and fruits, and number 3 is whole grains. And I will specify that it doesn't mean, hey, you're best for only eating the proteins. A lot of people are once again conflating because they see this graphic. Kind of the inherent issue, like you're talking about with the My Plate versus the food pyramid, is they assume, well, these are the best things, so I need to have the absolute most of this no matter what. And when no, it's supposed to be a balanced diet where you're getting all your minerals you need, the protein you need, things of that nature, the carbohydrates that you need in order to live a healthy life. What's your take with your background on the makeup of that to the 1, 2, 3 like that?
Yeah, I mean the order, that's population dependent. I mean, if we're talking athletes, they have a much higher need for carbohydrates, so they're not going to be sufficient, or they're not going to achieve the condition of what we call adequacy with this. They're going to need to increase that. With the higher protein intakes, I'll say this, and I always say this to folks, is Americans have the most expensive urine in the world. Meaning we consume, the RDA for the average person in the U.S. for protein is 0.8 grams per kilogram of body mass per day. Now, there are some special populations like older adults or high-level athletes that may need 1.2 to 1.4 grams per kilogram of mass per day, which is, as a comparative metric, is 50% higher than what the RDA is. That's a lot. Yeah. I mean, if we say, well, if you knew how the RDA is, if your audience knew the science, especially for protein, because that's a very solid empirical body of evidence that how much protein does the human body need? We know that it's about, because nitrogen balance studies inform that, and they're very precise, very accurate, and very well controlled. And there's a huge body of evidence that says in America it's about 0.8 grams per kilogram. For some special populations, because they have more muscle mass and then higher muscle protein turnover, they prospectively may have higher protein needs. So that's where we get to the 1.2 to 1.4. So then then people may say, well, how on earth could this have emerged where people are taking 2 to 3 grams of protein per kilogram of mass? Where does that come from? And how are people losing weight on those diets?
Yeah.
Here's how. Protein, even though it's classified as an energy nutrient, is still takes a lot of work to derive glucose from it. Glucose is how the body derives energy from foods. And because it's really hard to derive glucose from the amino acids broken down from proteins, it's not a great source for energy. And if you think about it, for somebody who has trouble managing weight and takes in an excess amount of calories, if you substitute carbohydrates, which is a good, easy source of glucose, you take that out and replace it, because that's how diet works. You take one thing out, it gets replaced with another. It's called the substitution effect. Don't forget that. If you do that with protein, your net glucose yield from the total foods that you eat in the day will be lower. And because of that, human organisms will lose weight. That's what's going on with more protein in the diet. And because excess weight in our population is a very interesting, salient, and important public health nutrition target, that has posed us well. Now, the question is there any harm with doing that? Not unless you have kidney disease or you're poor. Because protein is very expensive.
Yeah, it's a legitimate concern that people have with the model.
A legitimate concern.
Yeah.
But we've not specified the cost efficiency of animal protein in the diet.
Right.
There's a big body of evidence on that. But that doesn't get incorporated in the nutrition guidance nearly as much as, one, your audience might think, and two, as it should. There's a gap there that is really important. You know, we eat beef tenderloin at home, not because we're rich, because we're not. I have 2 kids in college, but because the amount of meat, the marginal cost of eating meat that's $17 a pound is about $1 per person more, given the amount of of that meat that we're eating. It's not $17. I call that the unit cost paradigm or enigma, where we look, oh my gosh, it's $17, and there's 4 people in our family, $17 a pound. And so that means that 4 people times 17, that's how much we're going to be spending. But we're not eating a pound.
Yeah.
We're eating red meat twice a month at that cost. So it's $2 per person a month to get that important nutrient, heme iron, in our body, and meet the dietary recommendations and enjoy a good steak a couple times a year. That's the way it should be consumed. And now, critics of mine and maybe others might ask, well, why is it at the top of the pyramid? Some might see that as overcompensation. Here's what I say about that. By eliminating red meat in real dairy, not these, the USDA has a class action lawsuit against the Blue Diamond Company, the soy milk companies, the oat milk companies, for using the word milk. Because the USDA's definition of milk is, albeit arcane, very clear, very succinct and concise, and important.
Yeah.
It's the lacteal exudate from the mammalian teat. That's what it is. And I would go around looking like a silly person when people say, oh, almond milk. I'm like, what do you mean almond milk? Almonds don't have teeth, so it couldn't be almond milk. It's
different profile of vitamins and minerals and everything else you get from that.
That's right. So then we look at the nutrient composition to say, well, you're being silly, Jason, making that distinction. But look at the nutrient composition. Let's do that. Look at the bioavailability of the calcium.
Yeah.
The whey and the casein protein balance in milk. It's exquisitely proportioned and designed to be optimal for skeletal muscle protein synthesis and fractional utilization of muscle, which is one of the important roles of protein in the human diet and in the body. And, it's important. Recall, I'm an exercise physiologist, and my appointment at the Friedman School was in the sarcopenia lab. That's age-related muscle wasting. So defending muscle mass in humans is good for a lot of reasons, not just for athletes and not just for bodybuilders, but for older adults, for young people. That's what determines your metabolism. And I hope and pray that our society can have a pragmatic, not emotional nor political response to these changes, and try to notice what the marginal differences are. The differences aren't great. Look in the middle of the pyramid. Those are similar. Fruits and vegetables. Most of our diet should be that.
Right.
Nuts, seeds, and legumes. Now that's been de-emphasized. Please let's keep those in our diet. Legumes like lentils and beans and things like that. Those are key foods in our diet, and they're very cost effective.
Right.
They're called pulses. We call them pulses. It's a type of class of a cereal grain, if you will. But getting dairy back in the diet, including the short-chain fatty acids that are in whole milk, dairy, and dairy products, that a lot of that goes beyond the scope of this discussion. But short-chain fatty acids play a major role in gut health, overall health, and the bioenergetics of diet. But and they're ubiquitous in dairy foods. Most people don't know that. That's not been part of the central debate because it's kind of a complex nutrition biochemistry concept. But if you could take my word for it, get whole milk dairy in your diet at the right frequency and quantities. We don't want to overconsume any one food. They all work together to promote our holistic health.
Yeah. All right, we're out of time, unfortunately. There's so much to involve. There's going to be books written about all this stuff. Like, there's a lot of details in here. Please think outside the box. Don't just go off the first news article that's out there that says this or that is happening, or this one alleged scientist or whatever said this or that's the case. Listen to the experts in the field of nutrition, coming from different schools of thought, because it's really important to get the big picture of what's going on. It's Media Analysis 101 is the biggest issue, I think, with this, and people get distracted by the RFK brainworms and all that. It is important that these guidelines are updated every 5 years, and this is a chance to look at it in another 5 years. It could be updated again, and maybe it'll go in a slightly different direction or hone what's here, which is really important. Dr. Jason Aziz, thank you so much for joining me today.
Thank you. I can't wait to hear your next take.
All right, NewEnglandTake.com to get more from the show. It's Substack. Be sure to sign up over there. Thank you, WKXL, for picking up the show. Next up over there is Facing the Future, brought to you by the Concord Coalition. Thanks to thegranitrock.com and Concord TV for picking up the program. If you got opinions on any of this, AJ at NewEnglandTake.com. I would love to hear from you. All right, talk to you soon.